South Africa's children under the age of 5 are facing a hunger and abuse crisis. That's according to a Child Gauge 2024 report by the University of Cape Town's Children Institute. The report monitors the National Integrated Early Childhood Development Policy that was established in 2015. Joining us now is Andries Viviers, who's Unicef South Africa's Education Manager. A very good afternoon to you, Andries. Thanks very much for your time. For how long has this crisis been going on? Do we know?
Thank you, Vuyo, and thank you for the opportunity also to share some information. I mean, the situation of young children and is something that is part of a macroeconomic context. So we know that at least, or if we talk about what the Child Gauge deal with, we talk about 7 million children under the age of 6 years, of which a very large percentage, 71%, lives in poverty. So if you live in poverty, it also means it's issues around food security that is there, that households does not have necessarily always enough food. And we also see that in our statistics that young children under the age of 5, 1 in 4 of them are stunted, which means it is a result of chronic malnutrition. And I must say, and I think what we need to know is that things did improve in South Africa. It is better than it was decades or 2 decades ago, but it's still not good for young children. We still need to do quite a lot, because what we must also remember is what happens in early childhood does not stay there. If we don't intervene now, young children will take it with them through their whole life.
Take us through the implications. Maybe we have no appreciation, of what this all means. We are alarmed, obviously, by what this report is telling us, but perhaps we have no real appreciation of what it means for the children in the future.
Okay, I think what we need to understand, and I think what we need to appreciate about the Child Gauge and the partners that are involved, of which UNICEF is one, is that the Child Gauge do what it says. It look at what is the status, and in this instance, of young children in the country. And it looks at the bad, but it also looks at the good. So and in this Child Gauge, the focus is what has worked, but are those things and those interventions that we still need. And one of the challenges is that we sometimes, or not sometimes, too often approach children and young children in silos. And we must remember a young child and his or her family are a single user of multiple services. So we need health interventions. We need to make sure that young children, to survive, needs to get immunized. And only 82% of children under the age of 1 is fully immunized by that age specifically. And the scary part is many of the child deaths might have been prevented through multiple interventions by health practitioners and society as a whole. And at this point, I think you've seen that in the Child Gauge, that one in every 25 children dies before their 5th birthday. The other part of it is also that we look specifically at multiple interventions. I've talked about nutrition and food security, but also the importance of child health, the health of the parents, particular maternal health care that is necessary. And in particular, I think what we need to do and look at is how families can be supported to make sure that young children survive and thrive. We have an excellent child support grant program in the country, but we need to make sure that it's also complemented with further income support, but also other programs that lead to food security. And then we also have, sorry?
Quickly, Andries, just to end the conversation, does the saying, "It's the economy stupid," sort of explains away what they're telling us and what this gauge has discovered?
Can you repeat the question?
I was saying, does the saying, it's the economy, stupid, does it begin to explain what we are talking about here?
I think in part, but not as a whole, because we need also to look at what is the responses that we have in terms of young children in particular. Obviously, economy has a impact because we know our Gini coefficient is very high and we have one of the most unequal societies in the world. But we also need to know that there are often in very dire circumstances, poor parents do take good care of their children.
Yeah.
But when you are in a situation where you can't find a job, that there is not enough income to buy the necessary food or to allow your children to go and engage in early learning opportunities and all of that, or to have access to healthcare, then that is the part where the economy also comes in.
Okay.
But I don't think we can only isolate the economy as the single contributing factor.
Andries Viviers, thank you very much for your time. He's an education manager with UNICEF South Africa.